Good morning. Uh, the next talk is from Dr. Kauser Usman. Friends, you know, Dr. Kauser Usman is a very good friend of mine. He is from KGMC Lucknow. He is professor in internal medicine and in charge of the geriatric department of KGMC Medical College Lucknow. And just for the extension of the next talk given by Madam Dr. Alka, he is now speaking on the problems of the caregivers for the management of our elderly patients having the certain problems. So over to Dr. Kauser Usman.
Respected Chairperson, ladies and gentlemen, good morning to all of you. This topic is caregiver burden and stress. I think almost all of us has played the role of the caregiver. I'll play the role. This topic is basically has many dimensions: social, financial, psychological. It's a less of the medicine. But anyway, this is my disclosure and disclaimer. So why this presentation? The world population is aging and will accelerate in most of the countries in next 50 years. Even India by 2050, about 19.5% of the population will be elderly. About 300 million person will be elderly. Individuals are living longer and often with the multiple chronic illnesses. Our goal for elderly is to age with dignity, and support of the caregiver is important to achieve this goal. Who is caregiver? A caregiver is someone who lives with, spends time with, observes, cares for, assists, and support a sufferer physically, emotionally, and socially. There are approximately 10 million caregivers in India, majority being family members. This is the norm in our country that the family member play a role of caregiver. And caregiver in India are predominantly women, 70 to 80%, either as a spouse or daughter-in-laws. But in our country, the recent changes have become basically challenges. On the one hand, urbanization has made that the support system is poor in the urban areas. And we have moved from the joint to point families, so putting more and more burden on the caregivers. The nuclear family, a small number of people, all out of the house. Sibling issues are there. Traditions, values, priorities, attitudes have changed a lot in the last 2-3 decades. There's a migration for the education and jobs, so the less number of people are there to support the elderly, and more women are working. These are the changes, or you can say challenges. But the Maintenance and Welfare of Parent and Senior Citizen Act is a hope for all of us. What is caregiver burden? The emotional, physical, and financial challenges faced by the family members or friends caring for the loved one with a chronic illness like CHF, COPD, or disability like a stroke, or cognitive impairment like dementia. And caring can have a detrimental impact on the caregiver's health and well-being. And research shows that these effects can be minimized to some extent or to much extent by the caregiver education, counseling, and support programs. What are the risk factors for the caregiver burden? Female gender, low educational attainment. If the person resides with the care recipient, behavioral challenges of the patient, social isolation, financial stress, more the number of hours is spending with the care receiver, lack of choice in being a caregiver. These are the risk factors for caregiver stress. These are the emotions which often feel helplessness, resentment, guilt, grief, and depression. And this grief is basically there is apprehension of the loss of other, loss of the patient, loss of self, loss of the former life which you used to enjoy, and loss of the expected future. So problems, the challenges the caregiving is, the most important one is emotional health or mental health. The person suffers from the anxiety, emotional exhaustion, caregiver guilt, and depression. Apart from it, the other important point is the physical health is also affected in the form of fatigue, because the erratic diet, lack of sleep, immune system gets weakened. There is increased risk of illness. There is increased risk of diabetes, hypertension, cardiovascular disease, arthritis. And even with the age-matched person, it has been seen that the risk of mortality is higher in the caregivers. And there are many caregivers who experience depression. It's a prevalent. And those who are depressed, they are likely to report higher levels of the burden. The studies have shown that about 18 to 47% of the caregivers are depressed. And apart from this physical and mental illness, there are secondary strains. There is a conflict with the work environment. Because of the erratic schedule, there may be financial strain, there may be loss of income or loss of job, out-of-pocket expenses. There may be relationship stress, and there's a loss of time for the self-care. So self-neglect is there, the caregivers. There is a reduced quality of sleep. Family conflict is also a common stressor that can impact the caregiver burden. Conflict can exist between the caregiver and care recipient. For example, between the spouses, for example, between the mother and daughter, or between the caregiving network. For example, the adult children of a frail elderly, they may have the conflict. And this conflict maybe about the care, balancing the need of healthy and sick family members, and interpersonal conflicts. So this is also a common stress. Another important aspect is that if the person, the care recipient, has the challenging behavior, especially dementia patients, they can be especially challenging and closely linked with the caregiver burden. For example, person with the dementia may experience wandering, incontinence, combativeness, disrobing, and resistance to care. And that's why each caregiver has a different breaking point. And the incontinence is the most important, most common breaking point for the caregiver. And behavioral problem is another breaking point for the caregiver. There are many caregivers who they don't realize that they are suffering from the caregiver stress or burnt out. And that's why it is very important to suspect that when the caregiver is suffering from the stress, and these are some important symptoms and signs and one should realize this. If the person is developing these signs, it means he is having the caregiver burnt out. So it can be handled timely, and one should not hesitate to take the help. Important is fatigue, irritability, carefulness, mood swing, problem sleeping, concentrating, or remembering the things, drinking, smoking, or erratic eating, either less or more, lack of interest in the routine activities, or an inability to complete the routine task, cutting back on the leisure activities. How to avoid this burnt out? Very important point. One should embrace the caregiving choice. If somebody made a conscious choice to provide care, so focus on the positive reasons behind that choice. You provide care to repay your parents for the care they have given you during your growing up. It may be because you want to set values and example for your children so that they will take care of you when you become elderly. This deep, meaningful motivation can help sustain you through difficult times. Practice acceptance. One should be realistic. Don't spend a tremendous amount of energy dwelling on things you can't change. If a cancer patient is there, is a terminal patient, for which there is no clear answer, so one should not waste time in thinking those things. Try to avoid the emotional trap of feeling sorry for yourself or searching for someone to blame. Look for the silver lining. The ways caregiving has made you stronger, how it is brought to you the closer. And imagine if your loved one would respond if they were healthy, if they were not preoccupied with the illness, with the pain or disability by dementia, how they feel about the love and care you are giving. So one should see the positive aspect during caregiving. You should break the big task into the manageable chunks. Make a to-do list for each day and begin to work through it one task at a time. Don't put too much on your day-to-day list and applaud your own efforts. Find way to acknowledge and reward yourself. Remind yourself of how much you are helping. What about the caregiver himself, caring a caregiver? When we go to the flight, we see the emergency measurement, we listen. It is often said, put your oxygen mask first before you help others. Similarly, maintaining your health and well-being is critical. Once the caregiver health and well-being is there, he can provide the greatest possible care to others, and which is often neglected. So there should be a caregiver self-care plan. Love yourself and be kind to yourself. You are a human being and no one is flawless. Error will occur. It is inevitable. As a caregiver, you can seek support from others. As you are having any trouble navigating your loved one's health, listen to your senses. Listen to what your senses are saying and you manage accordingly. Keep a self-care routine. Make time for yourself. and your requirements. Intersperse activities with the short rest times. Must get the time, even shorter breaks for your day-to-day exercise routine. Consume healthy, well-balanced diet, plenty of water, listen to the calming music or any relaxation, make getting good night sleep a priority. This is very common to have the shortage of sleep in the caregivers, which is harmful in the long term in the depressed immunity and the illness. Screen time. One should not choose the screen as a way to cope with the stress. It's an unhealthy way to coping with the stress because you spend too much time on your phone or computer. You'll feel isolated from your friends and family members. Look into the respite care. There must be temporary relief from your caregiving role. Enlist friend and family who live near you so they can help you. Don't expect the friends and family that they will automatically know your needs and your feelings. Be upfront about what's going on with you and the person that you are caring for. It's very important to share with others. Set up a regular check-in. Ask a family member or volunteer to call you at a regular time. Don't be shy about the accepting help. There are many people who feel good about supporting you. It's smart to have a list ready of the small tasks that others could easily take care. So one should delegate these small works to other your family and friend members. Try to get as many family members involved as possible. You may also divide up caregiving tasks. Enlist the help of family and friends who can do the meal preparation, babysitting, grocery shopping, etc. You can reduce your burden this way. You should one should schedule a family meeting also, and that during meeting you might talk about who is covering what expenses and who is available to help on specific days or weeks. Make use of technology. Even if you can't delegate certain responsibilities, but luckily we have so many technologies which are helpful in taking care of our elderly patient, like pressure mats and sensors around the home. For example, and it will cause an alert if your loved one with Alzheimer begin to wander. So one should not hesitate in taking the help of the technology. But once there is emotional exhaustion, one should not hesitate in taking the help of a professional or expert therapist. A trained therapist can assist you in processing your emotions, establishing the boundaries, and improving the communication with your partner and other family members. Here, this is important to understand that once the emotional exhaustion is there, it is equally important as for a physical element, you go to a doctor. There are certain important points keeping in view our scenario, our country, that what should be done. Because I've gone through the literature, there are very few studies has been done about the caregiving burden and stress. We are still in the, because as I mentioned, this has been normed that the family people play a role as a caregiver, but they're not so trained. And that's why this caregiver burden and stress is, the burden is too much. So there are certain areas which needs a priority research about caregiving. First, important is studies of burden on the family of different socioeconomic and educational backgrounds. Studies should be done of the characteristic of the caregiver and their effectiveness in caregiving. The cost effectiveness of the different interventions which is done as in caregiving. It was being discussed about our traditional system. It's also important point of study of the traditional system for the promotion of the mental health as yoga and meditation for the caregivers. And of course, the yoga and meditation can reduce the emotional burden of the caregivers. So a well-planned study should be there in relation to this. Another important point is stigma experience. Stigma experience of the caregivers, especially certain patients are there where the stigma is there. That's why the burden of the caregiver increases, not only in the term of the providing the care, but the social isolation. Very less people are there to support, especially with the patient of dementia, alcoholism, schizophrenia, cancer, intellectual disability, and what should be measures to fight the stigma. So this is the area which needs the priority and our research. What is the future need about the caregiving? We should prepare the psychoeducational material which is suitable to the Indian caregivers, because there are majority of the Indian caregivers not aware about the small important points in the caregiving. There should be a self-evaluation emotional health tool for use by the caregivers, that they should assess their emotional status by going through these health tools. As it was being mentioned by the previous speaker, that we should train more and more non-medical personnel in caregiving, and they should can provide the support and supervision. We should also be establishing the welfare services to meet the need of the caregivers. So to conclude, I would say that the caring for chronically ill individual can affect the caregiver's physical, mental, and emotional health. And as they strain to provide care for the others, family health is threatened. They suffer physically as well as mentally. So the caregiver should seek support and prioritize their own well-being. For a better caregiving, the priority should be their own health and well-being also. And the caregiver burden can be minimized to much extent by caregiver education, counseling by the trained personnels, and support programs. So the wellness, well-being, and welfare of the elderly depends on the caregivers. Thank you very much for your patient hearing.
Thank you very much, Dr. Kauser Usman, for your talk and for your very positive aspect of the whole aspect of caregiving. As you mentioned, it's a major load on the person who has to look after somebody who is chronically ill or unwell or bedbound or homebound for something. But you gave a very positive talk and spoke about how they can improve their physical and mental being for the sake of the patient. So it's open for questions to the audience.
Hello. We have produced on behalf of Geriatric Society of India many documents, books, handbooks, etc., etc. But I distinctly remember and will never forget in my life 4 years ago when one of our senior colleagues, he came with the idea that we are talking of doctors, physicians, nurses, everybody. We are not talking of caregivers. He brought out the idea and he called it non-clinical frontiers. That was purely about caregivers. 4 years ago, he printed this book on behalf of Geriatric Society of India with his personal donation of 50,000 and has started a course on caregivers. And the person is none other than Dr. Kaushik Ranjan Das. Give him a big hand. Our past president, he is continuously doing a course on caregivers program. Congratulations, Kaushik.
I have a question. I'm
Please,
Partho
tell
Rai.
us.
I'm Partho Rai from Kolkata. Thank you, Professor Usman, for a very visionary talk, very uplifting and aspirational talk like Professor Ganesh earlier on. You have highlighted, you have shined your torch on the unspoken person who provides all the care needs for chronically ill patients in the golden or silver lights of their years. The question is, till such time we set up the model of care that Professor Ganesh proposed, where we have the allied health professionals in the middle, sort of complementing the work of doctors. And here we have a next of kin, usually a spouse who is not much less old than the person he or she is caring for. And the immense stress that they have because of lack of training, knowledge, understanding, appreciation, and the burnout as a consequence and a failure to their own health. Now, the point is, there needs to be an economic model to support these individuals who are financially strained and also have often had to give up their jobs if they're the younger generation, their children. You talked about that model as well. And there are some parts of the world where there is a caregiver allowance that is given for people who have had to give up their jobs or do lesser jobs. And certainly for retired personnel, caregiving is a full-time profession. We are saying so much about their care, but where is the financial input to help them out of their financial disbalance that will constitute out of this? So I'm sure it's a question for us to raise with our policymakers so that this is recognized as work and not as a voluntary service, because it will lead to 12 hours per day of a full-time employment. So maybe that's something you could touch upon. And I think this is a brilliant way forward, including identifying the need for respite care, because I have had my mother looking after my father in his terminal 4.5 months. Tormentors, there's a huge element of guilt and lack of understanding. So there's a huge burden the caregivers carry because there's a guilt.
Yes, sir.
Yeah.
Yes,
So
sir.
there's two questions there, sir. Thank you.
No, of course, it's a very valid point, and I started with this, that this has a financial aspect, financial dimension also. The important part is there are many caregivers who lose their job,
Yes.
or they go for less time at their workplace, so they get the less amount, and of financial burden is already there. So there should be some support from the policymakers. This is there in the United States and the European countries,
Yeah.
but I will tell you, it is not a universal aid, universal help. This is the certain sector where they provide some relaxation, either in the term of the hours or in the term of the financial support to the caregivers. That is not universal. Same thing can be, at least this point can be raised to our policymakers for the caregivers, for a certain group of the patients where suffering is more, suffering of the caregiver is more. It's a very valid
And
point.
these are very easy
Sir,
identifiable because
we'll
yeah.
have to wind up because
Thank
we're
you.
short of time. Thank you.
Thank you very much. Thank you.